Yeah, hi. So I'm Sabahat Bokhari. I'm the professor of cardiology at Rutgers Robert Wood Johnson Medical School and also the director for Amyloid and Hypertrophic Cardiomyopathy Center and also for Advanced Cardiac Imaging Center. In my team, we have Dhruval Patel. He is a third year medical resident and working with our research group. And then we have Richika Bhargav, and she is a junior cardiologist who's working in our team. And then we have Alia Musa. She's a research fellow, so this is a small team which we have who worked on this project. So this review was for hypertrophic cardiomyopathy patients, and the review was mostly to increase the awareness about this disease and also to let the patients know about the advancement in the diagnostic methods and also the treatment for this disease. So in currently, if we look at total number of diagnosed patients in US, it's about 100,000 with this disease. And as we know that the disease prevalence is 1 in 200 or 1 in 500. So if we take 1 in 200, that's about 1.7 million people with this disease. And even if we take the lower number, 1 in 500, that's about 700,000 patients with this disease. But like I said, there are only 100,000 who have been diagnosed with this disease. So the main focus was to increase the awareness about this disease so people would start looking for this disease. So in the preparation process, we looked at all the current data and also looked at the history of this disease. Looked at when was the first this disease described and who described it. And then when was the first clinical significance of this disease described? And when was the genetic connection described? And then we took it forward and described it about what types of hypertrophic cardiomyopathy is there. And then took it forward to see how the patients present. What are the clinical red flags? And then what are the imaging red flags? And how do we diagnose this disease? And what are the current methods of treatment? And what are the future perspectives for treatment for this disease? So all those things we thought were very important to stress on so that people would know a lot more about this disease. So I think the most important perspective is that we discussed the new imaging modalities for diagnosing this disease, the new and we also discussed genomics this disease in this review, and also discussed the current and future treatments, and also discussed about the different trials. It also discussed about that the new trials which just came out, like Odyssey HCM, which showed that there was the treatment was unsuccessful in non-obstructive hypertrophic cardiomyopathy. So it's an extensive review about the disease. So the therapies which we start with the guidelines that we always start the patient with the uh, cardioselective beta blocker or non-vasodilating beta blockers. And then if that doesn't work, we go to non-dihydropyridine calcium channel blockers. And then if those don't work and if the patients are still symptomatic, then we move towards myosin inhibitors, which is Camzyos or mavacamten. And then also talked about the new myosin inhibitor, which is aficamten, which hopefully would be available soon. It's not FDA approved yet. And then we also talked about another medicine which we use to treat a lot this disease, but we still do some patients treat with that disease, which is disopyramide. And then also in this paper, we talked about the septal reduction in this paper therapy in these patients, either by surgery, by myectomies, or by alcohol septal ablation for these patients. And we also talked about some newer methods which are coming out for septal ablation. So I think it's mostly like what I answered in the last answer is that increasing the awareness of this disease for the readers, and then telling them about the newer methods of diagnosing this disease, and also telling them about the prevalence of this disease. I think most of the readers do not realize that this disease is present in 1 in 200 people or 1 in 500 people. So it's not a rare disease. It's a common disease. And like I said, that in US, where the population is 330 million, we have about 1.7 million people probably with this disease. And currently we have only 100,000 diagnosed. And even if we take the ones who are diagnosed, we know that 60 to 70% of the patients with hypertrophic cardiomyopathy have obstructive hypertrophic cardiomyopathy. And these patients who have obstructive hypertrophic cardiomyopathy, they are treated with mostly with the myosin inhibitor or with disopyramide. But when we look at the record, there are less than 30,000 people currently on treatment for obstructive hypertrophic cardiomyopathy. So even in the patients who are diagnosed, which is 100,000, not everyone is receiving the ideal treatment for this disease. And then also in this review, we discussed new treatment modalities which are coming up for disease modifying therapies, and also discussed about what were the endpoints for each trial and how did these trials lead to approval of these medications. So I think the biggest thing which I am working on is looking at research for increased wall thickness, right? So for patients who have heart muscle increased wall thickness, what diseases cause increased wall thickness? Hypertrophic cardiomyopathy is one of them. Amyloidosis is another one of them. And these are the two common ones. And they're usually mistaken for each other. Like about 7% of the patients who are diagnosed with hypertrophic cardiomyopathy really are misdiagnosed when they have amyloidosis. So I'm looking at mostly increased wall thickness diseases, and all my research is on that. And hypertrophic cardiomyopathy is a large part of that because the majority of the patients have hypertrophic cardiomyopathy who have that increased wall thickness after increased wall thickness due to uncontrolled hypertension or long-standing hypertension. Right, so that's an excellent question. I think future direction in HCM would be a lot with AI for diagnosis and also for identifying patients. I think AI will play a significant role by assessing the echocardiograms for imaging and seeing which patients might have hypertrophic cardiomyopathy. And then for treatment, right now we have myosin inhibitor treatment, which helps with quality of life by reducing their symptoms, but there's really no mortality benefit right now. So I think for future treatments, we need treatments which will have mortality benefit. And also there have been a lot of now drugs being studied in which they are looking at metabolism. So what if we change the fatty acid metabolism of the heart to glucose metabolism? Would that help with the symptoms and also with the prognosis? So there's a lot of exciting work being done in this field, and we hope to see some good results out of it. So I think with your journal, the reason we selected your journal was also because it's more to do with review. And we are doing a review paper on a very important heart condition. And your paper is, I think, is an excellent paper for reviews of cardiovascular medicine, right? So, and this is the major part. This I thought we thought that this would be a good paper to get our message across. Yeah, we had a very positive experience with your journal, including the timeline for the review and the comments. So we were very happy, and we in fact uh, have decided to send some more of our reviews to your journal because we had an excellent positive experience. So I think reviewers' comments were excellent, and which absolutely helped us to improve our manuscript, and we really appreciate their comments, and that helped to improve our paper.